In this chapter, we will discuss the setup of the SSEPs. Now, let's start with the position of the electrodes. In the figures that you can see here, we see all the electrodes that can be placed on the scalp of the patient, and you see that this is done according to the 10-20 system. Now, what is important for MEPs and SSEPs is not that complicated. It's basically the setup that you will see in the next figure, where we reduce the figure on the relevant electrodes for the MEPs and the SSEPs. Now you see the first row of the electrodes, T3, C3, CZ, C4 and T4, that are the MEP electrodes, which we'll discuss in another chapter. Relevant here is C/3, C/Z and C/4. And there's one additional electrode that is put in the neck of the patient, which is referred to as CV1 or electrode 1. So how do you find the position of the electrodes? Very simple. You take a ruler and you put it maybe first in the sagittal and then in the coronal area on the head of the patient, and you do the 10-20 measurement, and then you will be able to define the position of the MEP and SSEP electrodes. So things become a little clearer if you have a patient with not so much hair, and you can see the definite position of the SSEP electrodes in the second row behind the MEP electrodes. Here again the position of the CV1 or 1 electrode. Now, as we have now established the position of the electrodes to detect the SSEP signal, we need to discuss now the position of the electrodes to stimulate. And this is a bipolar stimulation for the tibial nerve, which is quite clearly seen. And here you see a little difficult to identify the position for the median nerve. Now that an anesthesiologist has plastered all over the hand, but you see the idea behind that here quite clearly. Now here you see the electrodes in place. The posterior, of course, corresponds to the SEP electrodes, and we labeled them for better understanding and visualization: C/3, C/Z, C/4, CV1 in the neck of the patient, and the reference FZ. So what you need to do now is to connect these electrodes to the machine that you're using, and obviously every department has probably different machines, so we don't go too much into details. We just want to show the principles that you have to put in the electrodes and the head boxes, and that connects it to the machines. So starting the bipolar stimulation of the median nerves, you see the jerking of the muscle, and can be sure that bipolar stimulation is working. You or your technicians will then set up the baseline program, and what you will hopefully see are the classical SSEPs for the tibial nerve or for the median nerve. And it is very important to get the baselines. As shown in this video, you see that the repetition rates averages the SSEPs for the median and for the tibial nerve, and you see beautiful signals which are comparable between both sides, so that at the moment you have no pathological MEP signal, and you are confident to start your surgery at the moment without a deficit at that baseline.